mean, all women, I mean, are men.
Absolutely, absolutely.
And I think stress is also
in the region
a key factor when it comes to. So what about, let's say, other factors such as smoking and the heavy kind of food that we usually have here in the Arab world?
Unhealthy food.
Unhealthy food, basically, yes.
Unhealthy food, probably would know, like fast food, which you will get nothing out of it. There are no antioxidants in this kind of food. It won't help the collagen. It won't help the elastin in the skin. It'll just make the thing worse. You know, it will build up toxic components in the body, and the body can't get rid of it.
Absolutely.
But if you just eat like fruit and vegetables on a regular basis, you'll be healthy. I mean, from all aspects, not only the cellulite.
Absolutely. This is very interesting. Dr. Mohammed, you mentioned something earlier on. You mentioned the region, or the Arab region, that maybe here the women are a little bit less active. The lifestyle, we mentioned food, smoking, junk food. What about race? Does race play a role in how extreme the cellulite is? Because we tend to see, I don't want to stereotype, but we tend to see that women of, let's say, of the Asian area are usually more small, they're usually more petite, and so on, and maybe Australian women are more tall and blah blah. Does this actually take into context cellulite and how bad or how extreme it could be?
In a way or another, that's right. Because like the skin is actually, there are 6 subtypes of skin. You have the skin type 1, which is the white or Caucasian people, and skin type 6, or like it's black colored people. We in the Arab, in the Middle East, probably we are between 4 and 5. You know, so the higher you are on this scale, the better your skin is, and the better is your collagen. So the more darker is the skin, the better is the skin type, the quality, as well as its the effect, its susceptibility to get cellulite will be less. So you'll see more cellulite in white people.
Wow.
Yeah, but it will be less in darker people.
Wow. Yeah. So race is an issue when it comes to cellulite. The darker you are, the less cellulite you will have, which is good news. Dr. Mohammed, let's move on to some of the surgical procedures, because earlier we spoke about liposuction and how maybe complicating it looked. Me and Diana was saying, how effective are some of the surgical procedures in eliminating cellulite, if there is such a case where we can eliminate cellulite?
There is like laser-assisted liposuction or lipoaspiration, and that helps very well because you'll have the effect of laser to get rid of the fat globules, and you'll have the effect of laser to help the remodeling of collagen. So it will help the skin, because we've said like the cellulite has 2 components, the skin component and the fat component. So laser mainly works on the skin and its components, and the liposuction will get rid of the fat.
Okay.
I'm presenting a paper on the next Australian plastic surgery meeting about this laser liposuction and its effect on cellulite and on the body contouring as well. I mean, just not on. And from the result we have obtained, it has showed a very promising actually result on patients, because like really you can combine both. You have the both effects, and it's probably like you can do it as an office procedure. It's not like an operation with the general anesthesia.
So not even lunch, a tea break.
Tea break, well, yeah.
It's very interesting, and I'm very important, sir, that we were talking about some type of, let's say, medical treatment when it comes to cellulite. And from your opinion, or let's say from your experience, sir, the older women do they get, let's say, more cellulite, or does cellulite reduce with age? Let's say above 40, above 50, for example.
It tends to decrease. Yeah, and then it will have another peak after the peak.
Come back.
No, because like it's as I told you earlier, it's related to hormones.
Exactly.
So
yes.
a lot of ladies, I mean, they take like hormone replacement therapy.
Okay.
I'm not sure if you know him.
Yeah, I do know. I do. Because I was like asking, let's say after menopause, for example.
So it's mainly based on estrogen.
Okay.
So I mean, we'll still have the estrogen effect on the fat as well as the skin, and we'll still have this cellulite at a later age. So probably in 30s, early 40s, and then they will have a break or something, and then after 55, 65, after the menopause, when they start having their HRTs or hormone replacement therapy, so they will still have the effect of estrogen on the fat and stuff like that.
What about those women who decide not to have hormone replacement therapy? How will the cellulite
They will have a less cellulite compared with women who are,
Okay. Well, Dr. Mohammed, we mentioned earlier that it's very common in post-pubertal women. 80 to 90% approximately of these post-pubertal women suffer from cellulite. And for their sake, I'm going to ask you, from your professional opinion, what is the most practical solution to cellulite? Or what's the most proven or effectively proven method of getting rid of cellulite or limiting it to as much as possible so it's not visible? We said that creams are not.
If I would like reframe the question, if you'd allow me, probably how can we avoid it or how can we prevent it? I mean, like if we can, like after puberty, if the girl or the lady will do a regular exercise.
Okay, well, prevention is better than cure.
Yeah, so probably prevention is better. So she will have a better skin tone.
So exercise, some tips.
Skin tone, and she will get rid of the fat at the same time. So if you see like a healthy lady who exercises 3 to 4 times a week, I bet, I mean, she doesn't have any cellulite, you know. But it's really a big problem. It's very hard. It's very hard to get rid of it if it's already well established. You will help to correct it, to treat it with the new modalities, as I mentioned, like the laser and stuff like that. But still, I mean, prevention is better than cure.
Okay, so we mentioned exercise, healthy food. What about
less stress?
Water intake. Does that make a difference? Water intake.
Water intake, like 8 to 10 cups a day, is very helpful for the body in general, but it has no like scientific evidence that it affects cellulite.
It doesn't help to shift or to move any cellulite pockets, as you mentioned.
It doesn't work on fat.
Okay. That's very interesting. And sir, I think let's say consultations with the patient is very important before you perform any surgical or any let's say laser therapy. Let's say, for example, if Russia or I were to come to your office or to any doctors in hopes of removing our cellulites, what are some of the steps that you take with the patients to make sure that they are stable, or let's say to make sure that this is what they really want?
First of all, deep listening to the patient. I have to very concentrate what the problem is and what are the patient wishes and what are the expectations.
So
this first thing. Also, from the after questioning the patient, I have to make sure the patient doesn't have any allergies. If she is on like medical treatment, or if she has any medical health problems, or if she were subjected to surgery in the past. And afterwards, I need to examine the area involved. I need to look at if there is a cellulite or not, because some women will come to you and say, "Look, doctor, I have a cellulite."
Probably,
it's not cellulite. So I have to first to know exactly is it cellulite or not.
Okay, good.
And afterwards, I'll decide if this patient is fit to get like laser liposuction or not.
So not everybody is a candidate.
It's mainly, I would say, like the majority of ladies are, but still there are some exceptions. Probably like 15% of the ladies who will not be fit for these kind of measures, because they have. It's not just cellulite; they will have a lot of skin redundancy. So I mean, the skin is very redundant. You would need this skin needs to be excised. It need to be like lifted with a surgical procedure. Because if you're gonna aspirate the fat, it will make the problem worse.
Oh wow!
You got the point?
Yes. Okay.
So you have to really make your decision whether it's really cellulite or not. And,
Oh wow!
This is great. Dr. Mohammed, just quickly before we go, you mentioned that some of the procedures are very quick. We can get it done on our lunch break or in our tea break or whatever it might be. But more importantly, how can we find a well-certified, trustworthy professional in the field? Because some of these treatments, as we mentioned, mesotherapy, require certain substances or medical components to be inserted in the body, and sometimes there are unfortunately doctors who are not well experienced, who are not practicing well, and this can actually result in